every time I'm like, ooh.
Hi, everybody. It's Katie Harris, owner and CEO of Nursepreneurs, and I'm here with Casey McGovern and Patricia Delgado from Sunrise Derm.
Hi, everybody.
All right. So Sunrise Derm is having a conference coming up next week. Patricia, you want to tell us a little bit about what's going on?
Sure. So the conference is Friday, October 20th to Saturday, October 21st. And it's a dermatology NPPA. It's actually the Sunrise NPPA Dermatology and Procedure Conference, but we're going to have some presentations on not only dermatology topics, but also a financial advisor is going to talk to us about passive income and financial freedom. And we're also going to have a vitiligo patient share her journey with us. And also we'll have a comedian talking to us about how to engage our patients and create more engaging presentations and just using comedy strategies in our day-to-day life to make things more interesting. And of course, a hair loss presentation and the main event. We have two main events concurrently. The basic procedure workshop, which is a hands-on workshop to help hone our skills with shape biopsies, punch biopsies, suturing, incision and drainage, how to mark your excision site. And then at the same time, we'll have the HS de-roofing workshop. So the procedure for de-roofing a hidradenitis suppurativa lesion will be presented and led by Dr. Barry Resnick from South Florida. And everyone will have their own, little fake skin and their instruments to sort of do some hands-on practice. I know it's not the same as working on a person, but, at least it'll give you that sort of muscle memory. Yeah. But it's going to be a really fun conference, and it's 1 week away, so we're almost there. And actually, we have a couple of seats left. So if anyone's interested in attending for free, we have a promo code available.
Oh, wow.
Mm-hmm. Okay, that's crazy because you guys, we already told Patricia when we talked last time, like it's crazy how inexpensive this conference was to begin with because there are so many good presentations and the procedure workshop and the HSD roofing. And it's in a really cool area. If you're not from Florida, but you're interested in jumping on a flight and flying down, St. Pete, Florida is just the sweetest little beach town with beautiful, it's on the Gulf side. So it's very pretty. The beaches are beautiful.
Yeah,
cool little town. And like Patricia said, the cool thing is that it's not just, sometimes it's like, how much derm can I really do? Well, first of all, you can do a lot, but it's really focused on being a well-rounded conference, which I love, right, Patricia? Like the financial stuff is so important, and we're really focusing on advanced practice providers sort of expanding their horizons, we'll say, by kind of improving their personal sort of finance health so that they can be a little bit more free in their careers to do things that they love and advocate for themselves. I love that you're doing that at the conference.
Yeah, thank you. And we're also having Dr. Stephanie Zimmerman, nurse practitioner, talking to us about sort of expanding your career as a dermatology nurse practitioner or PA, or in any specialty that you're working in. So talking about being on speaking bureaus and publishing and other opportunities also to work either with pharmaceutical companies or on your own.
Oh, wow.
Yeah. And even if you work within another practice, sort of treating your clinic, as your own brand. And I think that's also really important to sort of train us to have that independent mind and doing what's best for our patients. So it all kind of goes hand in hand.
Yeah, that's something that I really, really wanted because when I was a nurse practitioner in neurosurgery, like I couldn't see anything beyond what I was in. The only vision I had was, I guess I could go work for ortho or ENT. Wow. But, like that's not a career advancement. It's not a way to like further your career. It's something different for a small amount of time. But like I didn't really know that there were like speaker bureaus that I could go out to and develop a speaking career, or even like, I just learned about medical science liaisons that take, and I'm sure they have derm specialties for that. But there's so much that coulda, shoulda, woulda done if I had known,
Yeah, but you don't learn that, right, in nursing school or in your programs. They don't talk about, right, the avenues besides the very basic clinical ones, right, that everybody knows about.
Mm-hmm.
And derm is already like really exciting because I know I had a nurse practitioner friend who all she wanted was to get into a derm specialty, and they were tough to get into, especially in this area, in the Philadelphia area. It was hard to find derm positions. So I mean, I think getting out, networking, and actually knowing your stuff really puts you up, ahead of the game, because most people just want to be passively taught. And going to a conference like this, networking with people, learning about what you can do, and actively taking a role in educating yourself is huge.
And on top, so the other thing, after we talked last time, Patricia, sort of along those lines too, Katie, is I was thinking about for example, in my area, I'm in pediatrics, and we have one pretty much pediatric dermatologist in our local area, and she's amazing. And she has an NP that works with her. They're both incredible. But to get someone in with them, it usually is 6 months or more. And so if you have these skills, even if it's just about increasing access to care for your patients, some of this stuff you can take back to your primary care practice or whatever it is, and at least be the bridge until someone can see a derm specialist, because it is hard to get in with them often. Particularly, like I said, I'm in Orlando, but sometimes things are, patients and parents, they want a pediatric dermatologist, although maybe an adult derm could take care of whatever the thing is, but they want the ped specialist, and sometimes they're out of luck unless I can take care of it for them in the meantime.
Yep. And sometimes it's not even the parents that want the ped specialist. There's a lot of providers that just won't see kids.
Exactly. And that's the other piece of it.
Yep.
So, depending on where you are, maybe you're in a more rural area, or maybe you're just in an area where in general, there's not a whole lot of derm, in even adult derm specialists. And as a primary care provider, or a provider in a specialty that kind of overlaps with derm, you want to be able to offer services to your patients, and for potentially free with the discount code, getting there and staying, this is an awesome conference.
Yep. And honestly, even within the world of dermatology, there are not a ton of providers that are super comfortable with hidradenitis suppurativa. And so, having our friends and colleagues in primary care, in urgent care, like you said, to sort of bridge them until they can find a provider that's comfortable with HS. And part of the goal of this conference is for our derm providers to get more comfortable. But how great is it to have our urgent care, our gynecology, our primary care, emergency medicine providers getting comfortable so that they can get the ball rolling and at least get that diagnosis in, so the patient kind of knows what's going on, and then make their way to the dermatology provider.
Will you just quickly give an elevator speech about I can't even say it, hidradenitis suppurativa, because I had to look it up after I first talked to you.
Okay. So yeah, hidradenitis suppurativa, it's an autoimmune/autoinflammatory skin condition, but it affects a patient systemically as well, just like the other autoimmune skin conditions. But basically, it's characterized by inflamed nodules and inflamed cysts, also fistulas, some scarring in the axilla and below the breasts, in the groin, perianally, basically in the skin folds. It can affect one anatomical site, or it can be in multiple sites, depending on the severity. And the condition, it very often is progressive, and it very often is misdiagnosed as an inflamed cyst or an abscess. And that's why it's so important to really spend time with patients and ask those questions of, how often does this happen? Because this is not like a one-off thing. Oh, I got something in my underarm. It's a lesion that the patient will complain about again and again. And if we sort of just let it keep going, then it can start to multiply. The lesions, they'll become multiple. It can go to another area. So we really want to catch it early in our patients and start treating them early to prevent it from getting significantly worse and very disfiguring.
Yeah, because I was reading it can cause contractures and all kinds of things, right?
Oh yeah, all the scarring. So yeah, the skin contractures, it's painful to just move. So as the lesions will heal, it'll be that fibrous tissue, and then all of a sudden it's just hard to even move your arm because of
Yeah.
all the scar tissue.
And honestly, after I read about it, and again, my background is peds, but I've been in lots of different peds settings, and I read about it after you were talking about it with me, Patricia, and I immediately had like a Rolodex of patients that I'm like, huh, you know what I mean? That would maybe come in, I'd be in an urgent care setting, or I'd see something, you know, like that looked almost pimple-ish in that region during a routine well check, and it immediately made me think, I wonder how many of those I should have been thinking that way for and sending to a derm or, you know, investigating a little more.
Yeah. Yeah. And that's why I feel like this education is great for everybody. You know, like I would say just in all the specialties, but really trying to narrow it down for the conference. But yeah, it's really great information for everyone. And especially, you know, they say the most common age in which you develop HS is in your 20s, like post-pubertal. But I've seen adolescents with starting to get the lesions. So, you know, I think it's important also for peds too.
Yeah.
Yeah, definitely. And like what to Casey's point, like it's important for, you know, NPs that aren't even in the derm specialty to have some of this training, because anytime anybody hears that you're a nurse practitioner or a nurse, the first thing they do is show you their rash or their, you know, like, and I'm like, oh my God, please. But even like in the hospital, in the acute care setting, like so many of my consults were to derm because people would get, you know, like these red prickly bumps on their back from laying on sheets, you know, like, and I don't know if they were sweat related or what it was, but I mean, it's so helpful to have just a basic knowledge, especially when you're calling derm. Because I mean, I don't know, this might be a little flippant, but the dermatologists seem to work between like 10 and 2. So it's hard to get them to come over. And, you know, so you were stuck with like a patient with red itchy rashes for a while. They have a nice lifestyle. I'm going to say that.
Going back to the business side of things, or not business, but yes, business. I mean, the financial piece, in terms of your own like kind of personal financial wellness and, you know, multiple streams of income. And then Dr. Zimmerman with a Z or
Zimmerman, with an S.
With an S, I thought. Dr. Zimmerman's presentation about like personal branding, that is stuff that I think, and maybe I'm wrong, and maybe I'm just projecting my own sort of stuff onto other people, but not something that I had any confidence in at all, really, as you know, in my career, in my NP career. I didn't go to business school. I didn't go to marketing. And I didn't go into nursing ever thinking I would need those skills. And so as nurses, I'm assuming that most of us have no idea where to even start with that. So that stuff is just, in my opinion, again, just equally valuable at this conference because most of us are clueless.
Yeah, and that's part of what this conference is about. And honestly, like our number one goal for all of the attendees that come is to leave inspired, is to leave with like an kind of an action item list, you know, of people that you want to connect with, of things that you want to look up even more, of, you know, some items that you want to work on in your own practice, and you know, and having that Rolodex of patients that you want to go back and review their charts. It's really to just feel like you've had that aha moment about your own career and your own practice. And yeah, we don't really know about the marketing side. And there's a lot of people that want to maybe start their own business, whether it's a practice or a podcast or a coaching business or whatever it might be. But when you get in that world of entrepreneurship, it's a whole nother world. And Katie mentioned one of my favorite words and one of my favorite things, and it's networking. That is, I tell anyone that reaches out to me for just like free advice, it's networking. It's talking to people, it's learning from each other, growing with each other. And even if you work for another practice and you're happy, you know, you've got your supervising position and your colleagues and your staff, sure, the insurance companies, they market for you, but it's also important to be able to keep your patients happy and also have them wanting to see you, you know, and asking for you. Depending on your practice, sometimes they just sort of place them with whoever's there. But if you can sort of build your own client your patient base, then that's a really special thing to have. Or if you start at a new practice, you know, I've heard some nurse practitioners or PAs be kind of against it, but when I started both of my new jobs that I had as a dermatology nurse practitioner, I would visit primary care offices with some donuts, you know, with fruit or whatever, with my business cards and a list of our insurance companies that we took, and talk to people. I'd offer them lunch, you know, just talking, and people were impressed that it was, oh wow, the provider's here talking to us. And so just sort of, you know, networking and just talking to people, and it's not about always just the business part, it's about relationships.
Yes.
So
Business is always about relationship. And, you know, even as NPs, you know, I always told my NP students that, you know, 90 to 95% of what you do is going to be about relationships, you know, working with the admin, working with janitorial services, working with radiology, whoever. Like, you have to work with everybody across the entire spectrum of healthcare. And it's the exact same thing in business. Like, we all want kind of the quick and easy, let me just push this button on my computer and money's going to flow in. But the truth of the matter is that people want to know, like, and trust you. And that means that you have to get out and talk to them and meet them and that kind of stuff. And you can't push a button and make that happen. It takes time, it takes effort, but it's worth it, because the people that you network with, they want to see, everybody wants to see you succeed. Nobody wants to, you know, watch people flounder and fail. So when you build those relationships, you have a support system as well. So.
mm-hmm.
And one other thing I'll say that I want to add about networking, and I tell our nursepreneurs students this all the time, and I think the same applies right to APPs who are thinking about conferences. I think sometimes we get caught up thinking, well, you know, maybe derm isn't my thing, and I'm not going to go to a derm conference because I want to do something with this, whatever it is. But you don't realize how important it is to kind of network across industries and across specialties, because you really don't know the connection you might be missing to something, or the person that you're going to meet who's like, you know, there's so much value in expanding your network beyond what you think it should be, because most of us limit it, and you should be networking not only across specialties, but also across industries.
Mm-hmm.
You know what I mean? And so expanding that, we all kind of think, I don't know, like for me, I always think like, well, if I'm going to go to a conference this year, I'm going to go to the NAPNAP conference, which is my, you know, my certifying board, but I should go to other things. I should go to a leadership conference or a derm conference or something totally outside of what I think, because those are honestly where a lot of the best connections are made.
Yes.
Outside of your comfort zone, essentially.
Mm-hmm. Definitely. Yep. And also in healthcare, we're not on an island, you know, especially dermatology. We're kind of the window to everything else going on. So it would be awesome to get to know my local gynecologist or my local cardiologist, nephrologist, endocrinologist. So, you know, it sort of just mirrors what healthcare really is about.
Right.
Mm-hmm. Yeah, because I feel like that was my superpower when I was in working as a nurse practitioner, is that I could pretty much get anybody to show up because I had built relationships, and they would do me a favor, like, hey, I really need you guys to come over, like, right now. Like, I could call vascular service, I could call urology, I would call them on their personal cell phones, you know, and it would just, they would do things for me, and in return, like, I would do things for them. And it was just, you know, it is all about your relationships. And another thing that you had said, Patricia, you know, about bringing, having a collection of clients or patients, that's leverage, right? Like, if people are asking for you, you've got some serious leverage for getting raises, increasing bonuses, and for starting your own business, for sure, if you choose to go that route. But when people ask for you by name, that's just power.
Yeah, huge.
Yeah. So what we're talking about, guys, for those of you who are popping on, this is the Sunrise Derm Conference. It's NPPA Conference, Skin Dermatology Conference in St. Pete, Florida, and it's October
20th and 21st.
Okay. I don't want to say Saturday. Yeah, Saturday, Sunday, or Friday, Saturday. I'm sorry. and tickets are on sale. They're $99 plus Patricia has a discount code, so it's essentially free. So I mean, with flights being so cheap to St. Pete's or Tampa as you're flying in, this is just a huge opportunity for you guys to network, learn about starting your own clinic, business, learn about some derm conditions, do procedures. I mean, my God, this conference is worth. I mean, I would pay $500 to go to this conference.
Yeah, 100%. Tell also, Patricia, we talked last time about this, but I just think this is so fun too, because the price of the conference at $99, or if you get the discount code free, that in and of itself is what I would pay. Well, I would pay more than this for the headshot that people are going to get. So tell people about that headshot, because this is so cool too, just as a little fun bonus.
Yeah, so we got a brand photographer. So she's it's a boutique photography company, and it's a female entrepreneur here in St. Pete. And she's going to be taking headshots, but not just your average, business like LinkedIn profile picture headshot. It's going to be a brand photograph. So we'll have like a nice chair there, and she'll help people to pose, and it'll be more of kind of an interactive headshot, and you'll get one for free. And then you can talk to Destiny, and she can work with you if you want more. You can pay for more, but you will get one free brand headshot. Because again, our conference is about thinking outside the box, thinking outside the, just your island of the exam room, and seeing yourself more as a business and as an independent provider, regardless of where you work. So you get to sort of have your personality shine through in your photograph.
Yeah, like your power pose photo. I love it.
Yep.
I love it. And again, for $99, like you could pay more than that for just one really great brand photo. So
yeah, I asked her the cost of what a headshot would be with her usually, and she said about $600.
Oh my God.
Yeah, and that's the thing. She's a boutique photographer, so they're higher end, they're very high quality, and yeah, so this is huge that we have Lux photography at the conference.
Yeah. And yep. And again, it's just empowering too, that this entire conference, right? It's that empowerment piece. And again, like Patricia said, and I can't say it, enough and reiterate it enough. It's about advanced practice providers really recognizing how important our role is, and how we can take our role and really transform what that role looks like, and also transform a lot that's happening in healthcare, and at the same time be doing things that are good and feel good for us as individuals and as an industry. You know what I mean? Mm-hmm. It's kind of all of that in one, and it's exciting. We're finally all recognizing and stepping into the power that we have in a not a narcissistic way. It sounds kind of narcissistic when I say it that way, but you know what I mean?
Mm-hmm. Yeah, and just how important we are as nurse practitioners and PAs in the field of healthcare. I had a patient recently tell me that, nurse practitioners and PAs, good for you. They are the future of healthcare. And I'm like, yeah. And I sort of thought to myself, the future is now. This is our time. We are increasing access to care for our patients. We are empowering each other. We're learning together. And honestly, I want to give all the physicians and the residents a big hug and remind them that we're all in this together.
Yeah.
We're all against volume-based care, at least right. So, and we're all against reimbursement-based care. So, it's power in numbers. And so with Sunrise NPPA Derm, we're kind of starting with us.
Love it.
Love it.
So you can go to sunrisederm.org to register. Is the discount code on there, Patricia, if anyone gets on there, or how does that work?
So I will have anyone that's interested reach out to me directly.
Okay.
And they can email me. And the email is Patricia, M as in Mary, .delgado@gmail.com.
Okay, I'm putting that in the chat for anyone who's watching, patriciam.delgado@gmail.com. So you can reach out if you would like that discount code to literally get the conference for free.
Yep.
I love it.
I hope reach out. I hope people are fighting for that spot. You should be.
Yeah, I mean, I think I would just pay the $99 because I feel bad.
I know, exactly. Because there's so much value. It's so crazy. Yeah. You guys are awesome.
Awesome.
All right. Oh, someone said thanks. So hopefully you're emailing Patricia now, Rosina.
All right, everybody. Thank you so much. And definitely go to sunrise.org for this conference. It's next week, so don't delay. You got to go now and check it out and, arrange for getting down to St. Pete's, or if you live in the area. But block those days, October 20th and 21st.
All right.
Thank you for having me, Katie and Casey.
Thanks for coming.
Absolutely. Bye.
Bye.